welcome to today's tutorial where we are going to study diarrhea in children. Under diarrhea, we're going to look at the definition, classification, and management. When we talk of definition, it means it can be defined as passing out of loose waterless stool for 3 or more times in 24 hours. The most important here is including 3 or more passing out of loose stool and then in 24 hours. That is frequency and duration. So let me draw a table here of classification such that we can understand it far much better. So yes, when we talk of classification, we can observe that we can classify diarrhea under 3 categories. Diarrhea with no dehydration, diarrhea with some dehydration, and then diarrhea with severe dehydration. So let us see clinical features and then we see assessment. Weight loss, if the child has weight loss of less than 5%, that child has no dehydration. If the child has 5 to 10%, that child qualifies to have some dehydration. And if the child has lost more than 10% of the total body weight, then that child qualifies to be under severe dehydration. General appearance. If the child has diarrhea but is still alert and is still well, then that child has no dehydration. If the child has diarrhea and then is restless or is irritable, then that child is having some dehydration. If the child has diarrhea and then is lethargic or is unconscious, then that child is having severe dehydration. Let us look at skin pinch. You're going to make a skin pinch on your baby who is having diarrhea. If the skin pinch goes back immediately, or if it is a full skin tagger, then that child is having no dehydration. And if the skin pinch goes back slowly, that is to say less than 2 seconds, then that is some dehydration, as you have observed. And if the skin pinch goes back very slowly, that is more than 2 seconds, then that is severe dehydration. Now, I'm going to go into management because we can better manage this baby with diarrhea if we have mastered this classification of dehydration. Let's look at management. I'm also going to draw a table which is going to give us management plan. So when we look at management, we're going to manage diarrhea in 3 plans: plan A, plan B, and plan C. Basically, plan A is for management of diarrhea with no dehydration. Plan B is management of diarrhea with some dehydration, while plan C is management of diarrhea with severe dehydration. And we are saying plan A is home management, whereby we're going to give ORS and zinc. ORS, if your child is less than 2 years, just give 50 to 100 mils. And if the child is more than 2 years, give 100 to 200 mils. Every time the child passes out stool or whenever the child feels like he wants to take more. As for zinc, you are going to give 10 milligrams once a day for 14 days if your child is less than 6 months, and you are going to give 20 milligrams once a day for 14 days if your child is more than 6 months. In addition to ORS and zinc, remember to give your child more fluids, more food, and more breastfeeding if your child is still breastfeeding, which we can abbreviate as 3 F's. When we come to plan B management, this is clinic management or outpatient management, whereby when the child comes to the clinic, we are going to assess and then give ORS in first 4 hours. First give 20 mils per kg per hour, and then after 4 hours, you assess. So if you cannot calculate this, simply give 75 mils per kg, and then after 4 hours, you assess. If the child has improved, you go to plan A management, and if he has not yet improved, you repeat the procedure. If he worsens, then you go to plan C management. When we talk of plan C management, we basically mean hospital management, and this is for management of a child with severe dehydration. So basically, we're going to pass intravenous line, and then we give 100 ml per kg of normal saline or Ringer's lactate. If your child is less than 1 year, you're going to infuse in 6 hours. That is to say, 30 ml in the first hour, 30 ml per kg in the first hour, and then 70 ml per kilograms in the next 5 hours. If your child is more than 1 year, you're going to infuse in 3 hours. That is to say, 30 ml per kg in the first 30 minutes, and then 70 ml per kg in the next 2.5 hours. Remember, if the child is having shock, you shall first treat shock by giving 20 ml per kg in 30 minutes. And then when the child improves, you continue with plan C management. After, you keep assessing every 30 minutes. And if the child improves, then you go to plan B. If you manage plan B by giving ORS and zinc as we have seen, and then if the child improves again, you go to plan A, you discharge home, and then you advise the mother on how to continue giving ORS, zinc, and then plan A like we have seen. Thank you very much for being part of the lecture. Remember to subscribe to our YouTube, Facebook, and Twitter handle, EduMedicineDoc, for more lectures. Thank you. I wish you the best up to when we meet in the next lecture.